Hi all, I'm Mahalakshmi, clinical nutritionist from Wiley. Today I'm going to talk about gestational diabetes. So gestational diabetes is a condition that occurs during pregnancy and most cases disappears after childbirth. In this condition, the mother experiences high blood sugar levels. There's a hormonal shift, that is a particular hormone called human placental lactogen during pregnancy can reduce the effectiveness of the insulin, which means the glucose levels stay high in the blood instead of being used by the cells for the day-to-day activities. Approximately 4 to 14 out of pregnant women develop gestational diabetes. The risk of gestational diabetes can be both to the mother and also to the baby. So uncontrolled diabetes can lead you to high hypertension and high blood pressure for the mother, and when it comes to the baby it can increase the fetal risk of macrosomia. So during this time the fetus have a higher weight gain than the normal. Medical nutrition therapy is the first step in management of this condition. So balanced diet with a minimum calories is essential. The goal is to gain weight according to your prenatal BMI, that is before you could get pregnant, the prenatal BMI is taken into consideration, and also to avoid excessive weight gain and keep your blood sugar levels in control. Pregnant women with diabetes can safeguard themselves and their babies by adhering to a strictly diabetes diet. It can also prevent adverse effect of the condition and ensure a smooth pregnancy with a healthy newborn. So, here are a few dietary recommendations that you need to follow during your pregnancy. The first one is your carbohydrate intake. For those who are diagnosed with gestational diabetes, paying close attention to your carbohydrate intake is essential. If you're looking to manage your gestational diabetes with a balanced diet, here are a few things that you need to incorporate in your meals. The first one is your fruits. So incorporating certain fruits like your lemon, orange, guava and green apple into your diet can help you in boosting your vitamin C intake and also provide healthier alternative for your sweet cravings. The second one is your brown rice. So brown rice is an ideal alternative to your white rice. It offers slightly a lower glycemic index food where it does not substantially increase your sugar spike levels. Also, it has been loaded with vitamins, minerals and antioxidants. The third one is including good amount of grains, vegetables and legumes. So incorporating a variety of vegetables such as your beans, peas, lentils, corn, spinach and other green leafy vegetables along with your cereals like your millets, your oats, your barley, your brown rice, your quinoa can significantly impact in your sugar spike levels. Also, these can help you in supporting a healthy fiber intake and it can take care of your blood sugar spike levels. The next one is your protein intake. So throughout your pregnancy, there exists a need for a higher intake of protein as it serves a crucial purpose in development of your maternal components such as your blood, uterus and breast as well as the growth of the fetus and placental tissues. Protein can be included in form of your dry beans and lentils, which can be taken as your red chana, your rajma, your beans, your chickpeas and also your red lentils. These are loaded with your fiber, folate and iron. Also, you can include good amount of your paneer and soya. The paneer and soya is loaded with your protein and also fiber, which can help in your weight loss, bone health and diabetes treatment. Your soya is loaded with isoflavones. So this is a group of compounds which lowers the risk of diabetes and can help in managing your spike levels. Also, consider incorporating eggs in your meal as egg white has more protein and it can also substantially reduce your blood sugar spikes. The next one is your healthy fats. So keeping an eye on your fatty food consumption is recommended. It's best to moderate your intake of items such as butter, margarine, salad dressing, cooking oil and desserts. Additionally, it is advisable to that are high in saturated fat to be avoided, like your cheese, bacon, and hamburger. You can also include healthy fats like your avocado, as it is high in your complex carbohydrate and low in your glycemic index. You can include nuts like your almond, walnut, and peanuts, which are packed with vital nutrients, which are loaded with proteins and healthy fats, which helps in your heart health. For those with gestation diabetes, nuts make an ideal snack as they are low in carbohydrate content and high in protein and fiber and healthy fats, which is essential for maintaining a healthy diet. The next, we are going to see the Indian foods to avoid with gestational diabetes. So choose a healthier options and avoid foods that are high in your simple carbohydrates like your processed snack, white flour, as they can rapidly increase your blood sugar level. Here are some foods and beverages that you need to avoid while dealing with gestational diabetes. Knowing which items to limit or stay away is very essential. The first one is your soft drinks. So, if you happen to be dealing with gestational diabetes, it's best to stay away from sugar sweetened beverages like your soda, your fruit juices, and punches, as these drinks can cause a sudden spike in your blood sugar level immediately after your consumption, and they offer very less nutrition value. So go for healthier alternatives like drinking water or unsweetened beverages like your unsweetened tea or coffee to satisfy your thirst. The next one is your sweet. So limit sugary intake, limit your intake of your candy, your ice creams, your cakes, your donuts and baked treats. Remember, it's all about balance. The next, you need to avoid foods that are high in your starch. So research has shown that the starchy foods are high in carbohydrates have been potentially helped increasing your blood sugar level. So these foods that are your potatoes, your white rice, your white pastas and also overripe bananas can help in substantially increase your blood sugar level. So it is recommended to keep a watch on these intake of foods so that you can maintain a healthy blood sugar level. The next comes your alcohol. So, women who are pregnant need to abstain themselves from drinking alcohol. It is crucial for those who have been diagnosed with gestational diabetes. Even a tiny amount of alcohol intake can adversely affect the development of growing fetus. The next is your processed foods. So, expectant mothers need to be mindful of their food choices and steer clear of the junk food any shape or any form. So it's better to avoid the temptation of burgers, pizza and pasta as they're high in your calories and they're barely nutritional. So these are loaded with your artificial ingredients and chemicals which can harm your baby's health. The next one is fried food. So you need to avoid fried foods if you're suspected with gestational diabetes. The study shows a strong correlation between your frequent fried food consumption before pregnancy and the likelihood of developing gestational diabetes. The findings indicate that women who consume fried foods thrice a week are 13% more likely to develop gestational diabetes. So it is better to avoid them. In conclusion, the well-being of an expectant mother with gestational diabetes highly depends on adopting a balanced and a nutritious diet. Meal planning and portion control are crucial to balance your carbohydrate intake and prevent blood sugar spike. Thank you for watching our video. If you require any assistance, please don't hesitate to contact us.